Monday. Welcome back to this episode of Family in Focus, presented by the Asian Community Development Council, or ACDC. We're happy to see you here on PHLV Radio, on all of their platforms, every Monday, starting right at noon, to touch on the different topics affecting families, especially those in the Asian American Pacific Islander community. And today, one of the big issues that we're going to be talking about is enrollment, special enrollment period now being extended for uninsured Nevadans to able to get health insurance if they haven't been able to get health insurance this year. Of course, in light of the COVID-19 health emergency, President Biden has issued this executive order to extend this period. So to talk more about this, about who qualifies, how can you do this, how to get through the process as efficiently as possible, I do have some special guests on the show to talk about this today. First, we have Rosa Alejandre. She's the Navigator Program Manager for the Silver State Health Exchange. She's joining me to talk more about the program. We're also going to be joining later on with Sherry English. She is the Senior Account Manager with Select Plan, one of the latest insurance carriers to join the Silver State Health Exchange this year. And a little bit later on, we're going to bring in Yim Wen. She's with the Asian Community Development Council, ACDC. Yim is one of the healthcare navigators, and she also speaks fluent Vietnamese. So we're going to talk about the important aspect of how ACDC is involved as well. But first, I want to start off this conversation with Rosa. And Rosa, thank you so much for joining us today. I know you've been talking to us for quite a bit now about, opening and joining health insurance, especially with everything that's happening. But talk to me about this latest situation. Special enrollment period has been extended, and it's starting on February 15th. Is that correct?
Yes, good afternoon, Patranya, and thank you for having me on your program today. Yes, open enrollment will start again February 15th through May 15th. It is a special enrollment period. The good thing about this is that because President Biden has now announced a special enrollment period, we have been allowed to do an open enrollment period. What that means is that usually, in order for you to come onto the exchange once open enrollment has closed, which ours closed back January 15th, you would need a qualifying life event. Basically, you lost your job, you got married, you lost your health insurance. That's a qualifying life event. But right now, what will happen February 15th through May 15th is anyone that is in Nevada that qualifies to get health insurance and did not get health insurance during our general open enrollment, which ended January 15th. Starting as of February 15th through May 15th, you will have another opportunity to join the exchange. And so the exchange is also commonly referred to as either Obamacare or the ACA. That's ACA is technically the name. We run here, Silver State Health Insurance Exchange runs the program for the ACA in the state of Nevada. We are a state-based exchange, and we are following suit with the FFM, meaning that the healthcare.gov runs about 38 other states. And so we no longer use that platform. So we are now a state-based exchange. So therefore our leadership decided at Nevada HealthLink that we would also participate in this new open enrollment period that President Biden has just announced. Again, it'll start February 15th through May 15th.
So this is not every state. Nevada is just some of the states that are extending this for people,
exactly.
Right?
Exactly. Not every state has to do it. If you are part of the FFM, they will do it. Anyone that participates with healthcare.gov. But if you're a state-based exchange, the state in itself has the choice to decide whether they want to participate or not. And it has a lot of variables involved in it, feasibility, call center and all that in the background. But thankfully, our good leadership here at Nevada HealthLink, they have the foresight and they understand the importance of being covered, especially right now during this COVID pandemic. So we are able to go ahead and open it up as well, just like the feds have.
And talk to me about the importance of this, especially in light of this executive order. It's just that a lot of people are, of course, affected by COVID-19, and that's a concern coming from the federal government, right?
Yes. So as I mentioned earlier, usually in order for you to come onto the exchange once open enrollment has closed would be in order for you to have a qualifying life event. So qualifying life events can happen at any time during the year. And when that happens and you lose your health insurance, whether by you or your spouse or your parents or what have you, your partner, you have 60 days from that day of losing the health insurance to come onto the exchange. With this open enrollment period, it's anyone that has not had coverage. So if you did not jump on to our open enrollment during November 1st through January 15th, you now have an opportunity come February 15th through May 15th to join one of our plans. We have 5 carriers. You have Sherry English here from Select Health. So she's one of our carriers, brand new for our exchange, and we're really excited to have them also participate on us. But we have several plans available for anybody that's looking for health insurance. We know, especially here in Southern Nevada, with a lot of the casinos, many employees are facing the challenge of, well, now they're not getting health coverage, or they've recently been laid off or furloughed or what have you. Please give us a call at nevadahealthlink.com. We have many navigators to assist you. As you know, as you mentioned, ACDC is one of our navigators that can assist you in person or over the phone. So we're really glad to have this open enrollment again to help right now for our consumers that are really needing health insurance during this difficult time.
Yeah, and I think a lot of families who are listening right now, this may be something that they're not aware of, and they need this help, and they haven't got health insurance for whatever reason. So this is the second chance for them to be able to do this, which I think is really great information. So you mentioned Select Health is one of the newest insurance carriers that jumped on board with the Silver State Health Exchange this year. And we do have Sherry English, who is the senior account manager here in Nevada for Select Health. So Sherry, thank you so much for joining us on this call today. And Select Health may be kind of a new, term for a lot of people. They haven't heard it much here in Nevada. So do you want to talk to us a little bit about what makes your health insurance company a unique one here in the state right now?
Absolutely. Thank you so much for allowing me to be on your program. I'm super excited to be in Nevada. We are in Clark and Nye County, so any families residing in Clark and Nye County have access to our plans. We have 5 plans on market. And of those 5 plans, one is a high deductible health plan, which allows a member to set up a health savings account. We are new to the Nevada market, but we are not new. Our story is that we are an integrated health system with Intermountain Healthcare. Intermountain Healthcare has been around since 1975, and we have been a part of them since 1984. This allows us to provide integrated services to our members, which gives them a low cost, and it's really seamless for them to go in and have services rendered. Our mission is to help people live the healthiest lifestyles possible. And between Utah, Idaho, and Nevada, we have over 900,000 members. Wow. With our exchange plans, our traditional plans allow members to have first dollar coverage for primary care visits, behavioral health, urgent care, minor diagnostics. We have a $0 cost, so no cost to the member to use our virtual visit. So you can call and talk to a doctor who can prescribe you medication at no cost to you. We also have preventative services and wellness rewards program. Just for living healthy, we will give you $20 a month if you are a member of a gym or you live an active lifestyle. We have some great options.
Yeah, no, and that's great. And I think right now for people, the more options they have to pick from, especially when it comes to health insurance, just different, range of affordability and different kinds of plans. And I know that with you can go in network or out network. So lots of options for people who apply for your plan. But talk to me a little bit about COVID-19 and what you offer in terms of vaccinations, treatment, that kind of thing.
So we want to take care of our members, and so we are here for you for COVID-19, regardless of the plan you enroll on. As long as you go to an in-network facility for testing, vaccinations, or treatment, it is covered 100%. So that means that you are not taking any money out of your pocket to have those services rendered. The one caveat to that I would say is if you have to go somewhere for an emergency and you go to an out-of-network facility, we will pay our in-network rates. However, we're not contracted with that facility, so they could balance bill you. But if you are going to an in-network facility with us, we are covering testing, treatment, and vaccinations at 100%.
And where can people find more information if they're looking to maybe consider Select Health?
You want to go to our website, selecthealth.org. That's going to give you information about our coverage for COVID-19 right on the homepage. And that's also where you can search providers to see if it's a good fit for you, if your doctor is in network, and if they are in network, if there's another doctor that will fit your needs. To find a doctor, it's right at the top of the homepage, and it literally says, find a doctor.
Great. Yeah. The more options people have, the better. And Rosa, I want to bring you back in the conversation here. I know we had, a couple of new carriers coming on this year. What does that do for the Silver State Health Exchange to give people more options when it comes to health plan carriers?
The best part about it is this, Patranya, that with the 5 carriers that we now have this year on the exchange, they have 50 plans to choose from. So I know out of the 50 plans, there is something that they can choose and will best fit their budget. That's the best part about it. And it'll fit whatever coverage that they need. All of our plans cover pre-existing conditions, so there is no issue there. And all of our plans have the 10 essential health benefits. So when you get a plan through the exchange, be it through Select Health or any of our other carriers that we have on the exchange, you're going to get complete comprehensive coverage through one of our plans. It will be up to you. And also know that with Nevada Health Link, it's the only place that will offer you any type of tax subsidies, whether it's advanced premium tax credits and or subsidies. So only at Nevada Health Link can consumers get that. So it's really important that our consumers know where to go directly for assistance.
And for people who are new to this idea of the online state-based exchange and also your relationship working with nonprofits like ACDC, why is it so important to have that kind of relationship, especially with ACDC having these healthcare navigators in place to help? Their licensed, right, state licensed healthcare navigators.
Yes. So at the exchange, none of the actual people that work there, none of the employees actually sell the insurance. We have navigators and brokers that we work with. So throughout the state of Nevada, all of our navigators are certified and licensed by the Department of Insurance, and they're licensed by the state of Nevada to go ahead and offer this assistance. So when you speak with a navigator, you're going to give them a lot of personal information, and we just want to make sure that the people that are helping our consumers here in Nevada have been screened. They've gone through FBI background checks, they have insurance and what have you. So they know exactly what they're dealing with, and they know how to keep your information confidential. And it's important to work with the nonprofit groups because our communities also know that they offer other resources. And so we want to make sure that it's a resource available for them. Not everybody may know who Nevada Health Link is or who Silver State Health Insurance Exchange is, but more people may know who ACDC is or one of our other grantees, right? So that is a leverage that we like to use in the community. We have a lot of, like I said, there's 8 not state agencies, but there's 8 agencies that are navigator grantees, and we have over 600 brokers that are helping consumers, and they're all certified, and you can find them all on our website at nevadahealthlink.com. But it's really important that they understand with any of our grantees, assistance is free and in their language.
And I think that's why, people like Yim, who's joining us today on this call as well. Yim Yuen is a healthcare navigators with Asian Community Development Council, or ACDC. Yim, how are you? Good to see you here today.
Yes, it's so great. Thank you.
Thank you. And Yim is one of the healthcare navigators who speak fluent Vietnamese. They have navigators who speak Chinese, Tagalog, where people can help in Thai as well, along with Vietnamese. So since we have you with us today, Yim, and joining us on this call, do you want to share some of the information we're putting out today in Vietnamese for people who are listening in Vietnamese right now?
Yes. Chào mọi người, mình tên là Diễm Nguyễn, hiện nay đang làm Health Navigator của ACDC. Như mọi người biết là mỗi năm mình chỉ có được một lần để đăng ký bảo hiểm y tế vào tháng 11, nhưng mà bây giờ mình sẽ có một cái cơ hội nữa dành cho những người nào mà chưa đăng ký, là bắt đầu từ ngày 15 tháng 2 đến ngày 15 tới tháng 5 năm 2021. Nếu ai có cần hỗ trợ để đăng ký bảo hiểm y tế, vui lòng liên lạc với Diễm theo số điện thoại 702 677 2277. Cảm ơn. Thank you.
Awesome. Thank you, Yem. And we want to put up some information on the screen for our viewers who are listening and watching right now to see that the licensed navigators, people, ACDC, we have two main offices now. We have one, the main headquarters is on Flamingo, our brand new headquarters at 8863 West Flamingo Road, Suite 101 in Las Vegas. They still offer services at Shanghai Plaza at 4276 Spring Mountain Road, Suite 207. So these are the places you can go. You can call them directly and you can email them as well. Again, these are, you can do on by appointment. You can actually meet these navigators in person along with getting help through Zoom and phone as well. So lots of good services out there. And I think this, if anything, this conversation and this kind of help is just to give power to so many of the populations out there who may not have, you know, the language, and they may be running into barriers for different reasons, not just language, but to get this important information about signing up for health insurance. And Rosa, I'm sure you've talked to many of the people out there in the community who need this. Like, this extension is, you know, in some ways life-saving for their families, right?
Oh, most definitely, Patranya. A lot of people, even though we do a lot of advertising about open enrollment, they skip it, they miss it, they just don't hear about it for whatever reason, right? And we're all busy, I get it. You know, we were all busy with life and working and kids and school and house and everything, right? But so this is really a special opportunity for those. If you just skipped it for whatever reason, please give us a call February 15th through May 15th at NevadaHealthLink.com. You can call ACDC directly if you'd like, but please get covered, because the last thing you want is to have something happen to you, you get sick or what have you, and then you have no health coverage. Sometimes when consumers don't realize it, you end up in the hospital, you know, as a last recourse, and bills can be quite pricey. You know, you end up in the hospital, you can go from anywhere really quick, $5,000, $10,000, $15,000, $20,000, and that can put somebody in financial ruin. We've seen where, you know, people have filed bankruptcy over medical situations and medical bills, right? So that's what we want to prevent. We're here to help you. We're here all year long. NevadaHealthLink.com is here all year long to assist you. Our navigators are here all year long. So just give us a call and we will see how we can help you, whether it's in person or over the phone. We just want to make sure that if you need coverage and we can assist you, whether it's directly through one of our exchange plans and or Medicaid, we will find a way to help you get covered. And that's all we want to do.
And Sherry, I wanted to bring you in here for your final word from your end at Select Health. I'm sure just with everything that's happening with COVID-19, you know, everything that Rosa was talking about, it's just so important for your company. This is kind of what's driving, you know, your people to work so hard to get people the health insurance, correct?
Yeah, absolutely. COVID-19, like Rosa said, COVID-19 could financially ruin you if you don't have insurance plan to help you with those bills. But also, we can all think off the top of our head and name somebody that we know, whether it's family, friend, coworker that has been diagnosed with cancer, rheumatoid arthritis, MS. Those are some, or been in a horrible car accident. Those are some things that definitely can financially ruin you. And so we are here to help you with that risk and give you benefits to help you with that risk.
Do you want to confirm again where people can find information and for your company and for your health insurance plan?
Absolutely. If you visit selecthealth.org, that's going to give you information regarding our plans, our providers, so our doctors and facilities, along with information on our COVID-19 coverage.
All right, Cheryl. Thank you so much for joining us today and giving us great information. And Rosa, you as well. I think you're going to be busy starting next Monday, right? When people start applying again. Any last word, any kind of advice for people out there just looking to, okay, I need to do this. I need to get on this. I missed it the first round and I need to do this now.
Please try not to procrastinate. We start February 15th through May 15th. It is 90 days, but don't wait till the last minute. Give us a call either at 1-800-547-2927 or NevadaHealthLink.com, or call ACDC. They are a great bunch of folks there that can help you in any language and will be more than happy to assist you in any which way they can to make sure you get some assistance for health coverage.
All right. Yeah. And we'll put more information after this video as well. And if you're watching this right now and you think this is great information for your friends and family, this is on staying on social media, so this is good. Some of the things that we really like to stay on as long as possible is this kind of information, because you can share, right? You can share this information, share the link, share the video, and pass it on to your family and friends, and know the ACDC is around to get help in other languages. If they're not familiar, I know getting health insurance is such an overwhelming process for so many people, because there's so much information to absorb. And that's why people like Yim Wen and her team with the healthcare navigators at ACDC are just so important for this process here in Nevada. So again, thank you to all my guests, Rosa Alejandre, Sherry English, and Yim Wen with ACDC, joining me on this conversation today. And we're going to be back next week with more information to help your friends and family through this show, Family in Focus, on PHLV Radio, brought to you by the Asian Community Development Council. We'll see you soon.